All right, today we're putting on our detective hats. We're diving into a case file called Altered Mental Status. And let me tell you, this is a high-stakes mystery where every single clue, no matter how small, really matters. So let's start the investigation.
Okay, picture this. The call comes in, someone is confused, they're not acting right. Is it drugs, a hidden injury, some kind of medical crisis? That first impression is just the cover of the book. The real story, the one that could actually save a life, is hidden inside. So where do we even begin?
Well, that brings us right to the heart of the matter. This is a complex medical mystery. See, altered mental status isn't one simple thing. It's a single symptom, a single clue that can point in 1,000 different directions. It turns every single call into its own unique puzzle.
So what are we actually dealing with here officially? The clinical guidelines define it as a condition that can pop up from a whole host of diseases and injuries. And that's exactly why the phrase, a careful investigation, isn't just a friendly suggestion, it's the absolute foundation of everything you do.
Now, let's get down to business. The first part of any investigation is gathering clues. And in a medical emergency, this is probably the most critical phase. You have to systematically collect evidence right there on the scene before it disappears or changes.
And there's a method to the madness. The guidelines lay out this really clear three-part framework. First, you assess the patient themselves. Then, you assess the scene. What is the environment telling you? And finally, you assess the circumstances. What events led up to this moment? It's like a methodical sweep for any and all evidence.
And you know, the guidelines really stress that you have to pay attention to the subtle stuff. I mean, a major injury is obvious, right? But a small, hidden bump on the head, that could be the key that unlocks this entire mystery. Finding any sign of head trauma can completely change your direction of care, leading to critical moves like taking spinal precautions.
And this brings us to the biggest twist in any investigation, the red herring. You know, that thing that seems obvious but is designed to mislead you? The most obvious answer is often the most dangerous one because it can blind you to the actual truth. And in medicine, first assumptions can be deadly. This quote right here from the source material. This is the golden rule for our medical detective. It's a direct warning against what we call cognitive bias, getting tunnel vision. Just because a patient has a known history doesn't automatically mean it's the cause of the problem today. The key takeaway is you have to always look deeper. Let's make this crystal clear with an example. On the left, you've got the easy assumption. A patient has a history of alcohol abuse, so they must just be intoxicated. But look at the right. Look at the hidden reality. Did you know that these patients are at a super high risk for hypoglycemia, that's low blood sugar? Or what if they fell and hit their head? Or even worse, what if they're a victim of violence? That's two totally different stories for the exact same patient. And believe me, that list of hidden dangers just keeps going. Co-morbid conditions, which just means other medical issues happening at the same time, are really common. We already mentioned violence, and sometimes a severe behavioral problem might need its own specific treatment, like sedation, just to keep everyone safe. A patient's history is just one chapter. It's not the whole book.
Okay, so let's take these principles and apply them to a specific case file, an overdose intervention. Now, in this scenario, our investigation has to lead to very swift, very precise action.
You know, even the best detectives have to call in the experts sometimes. For a suspected overdose, or if you think someone swallowed something toxic, talking to an expert is an absolutely critical step. You don't have to have all the answers yourself, but you do need to know who to call.
And that crucial call? It goes right here to poison control. They are the specialists, and they can provide immediate, life-saving advice on what to do next, how to treat, and where to transport. They're a vital partner in solving the case. When it comes to giving naloxone, also known as Narcan, precision is everything. The maximum amount you want to give in a single nostril is just 1 milliliter. It's a tiny detail, but it's a detail that has massive implications for whether the treatment works effectively. So let's say the patient is stabilized on scene. Awesome. Case closed, right? Nope, not even close. For the medical detective, the work continues, because what happens right after the emergency is just as critical as the event itself.
After that initial emergency, there are some rules that are absolutely non-negotiable. First, any patient who gets naloxone must be evaluated in the ER. Second, if they need more than one dose, they're going to need advanced life support during transport. And this last one, this is truly life or death. You never give naloxone to newborns. It can cause acute withdrawal and seizures. It just goes to show you that expertise is critical at every single stage.
And all of this brings us full circle.
This quote right here perfectly sums up our entire investigation. The physical exam tells you what's happening right now. But a careful history, I'm talking about listening to the patient, the family, observing the scene, that tells you why it's happening. And it's the combination of the two that solves the mystery.
So, we've gone through the detective's playbook, but the final clue isn't really for a patient. It's for us. Now that you know the complex story that could be hiding behind someone's confusion or disorientation, how does that change the assumptions you might make when you see someone in distress in your own life? That's definitely something to think about.